Alright, my name is Cole. I'm going to be doing a physical assessment on you. I'm going to tell you everything as we go, and you have the right to refuse anything, and if you'll just follow along with me, we're going to start with your head and we're going to work all the way down your body, okay?
Sounds good.
Alright, I'm going to check your hair, and I'm going to inspect it. I don't feel any nodules, bumps. That doesn't hurt, does it?
No.
Even distribution of his hair. Now I'm going to look in your eyes. I'm going to shine this pen light, okay? His pupils are equal and round, and they do react to light. I'm going to bend your eyes down. Sclera is all white, no jaundice or anything. Nothing appears to be in his eyes. His irises are blue, and he does not wear any corrective lenses. Equal distribution on his eyebrows, good. Going to palpate them. No, none of this hurts, does it?
No.
Nothing tender. I'm going to check his temporal arteries. Both of them appear to be symmetrical, nothing bounding, normal. Now I'm going to open your mouth and I'm going to inspect your mouth. Can you go eye? All mouth seems to be pink and moist. All teeth are intact, no lesions. Uvula is intact and symmetrical too. Tongue symmetrical. And that is it for that.
Okay.
Now I'm going to look in your ears and just inspect them and kind of palpate around them. No drainage on his right ear. No drainage. You got any? Does this hurt when I pull on it or anything?
No.
No drainage or anything in that ear, in his left ear. I'm gonna look up your nose. Patient does appear to have just a little bit of hair in his nose, no kinds of drainage, no forms of that. Let's see. Now I'm going to. Can you smile for me?
Mm-hmm.
Okay. Patient's face is appeared intact. All right. And can you clench your teeth real tight for me? I'm gonna check your temporomandibular. You squeeze. Does that hurt when I push down on it? Okay. Both of those are symmetrical, and he pushes against resistance. Now I'm gonna get you to close your eyes and tell me when you feel this. Okay.
I do.
All right. Patient can feel on both sides. Motor and sensory both functioning perfectly. I'm gonna get you to lift your neck up for me, and I'm gonna just inspect and palpate around it. Any tenderness? Do you have any tenderness in this?
No.
Okay. I'm gonna check all of your lymph nodes now. Okay. Start with a occipital or auricular. Preauricular, postauricular, occipital. Submandible, mandible, deep cervical, or deep clavicular. I'm sorry, and supraclavicular. Any of those appear to be painful?
Yeah.
No nodules that were hard. All were soft and firm. Can you touch your chin to your neck? Can you tilt it back for me? Can you move it side to side for me? Patient's cranial nerve appears to be intact. No soreness or anything with that.
Mm-hmm.
All right. I'm going to palpate right here, okay? Patient's trachea is symmetrical. I'm gonna feel for your lymph nodes, okay? I mean thyroid. Can you turn left to right for me? any tenderness right there when I did that. Patient's lymph nodes are soft and palpable. Now I'm going to listen to his carotids. First I'm going to palpate them. You lift your neck up for me. Patient's left side is bounding, or not bounding, but appears not to be bounding, and both sides are symmetrical. Now I'm going to listen for bruits in them. Patient does not have any bruits in his carotid arteries. Now we're going to listen for, I'm going to get you to lay down now, and if you'll take your shirt off for me. Well, actually, I'm going to get you to keep standing up or sitting up. I'm going to listen to your back, okay? Anyway, you can turn a little bit for me, a little bit more. A little bit more. I'm going to listen to his breath sounds on his back, all 9 locations. Patient's back is symmetrical, no lesions. Any tenderness anywhere right here?
No.
Okay. Any right here?
No.
Okay. Now I'm going to listen to the patient's breath sounds. Patient's lung sounds bilateral or posteriorly and laterally were clear bilateral, and he had no tenderness in palpation. Now I'm going to percuss to check for this cerebral ventricular angle. Tell me if you got any pain with this or any tenderness, okay?
Okay.
Anything?
No.
Anything?
No.
Alright. Patient does not appear to be in any sort of tenderness or pain. Now I'm going to get you to take your shirt off and lay back for me, okay? Patient's chest does appear symmetrical. He does have even hair distribution throughout it. I'm going symmetrical, no signs of any form of lumps or any kind of scars or scratches, anything. And now I'm going to listen to your heart sounds, okay?
Alright.
I can hear the PMI on your patient. Now I'm going to auscultate for any bruits or murmurs using my bell side. No murmurs heard on auscultation. Now I'm going to inspect the skin of his abdomen. I forgot to note the locations I listened to is aortic, pulmonic, tricuspid, and mitral on his heart. Now I'm going to inspect your abdomen. Abdomen does appear to be rounded. Is it tender to touch? No tenderness to touch.
Yeah.
I'm going to no visible peristalsis. Patient does not appear to have his umbilicus is inverted, so no seen hernia that is visible. Now I'm going to listen to your bowels. Okay. I've been auscultating all four quadrants. Patient does appear to have normal active bowel sounds. Now I'm going to listen for any bruits in his aorta or renal arteries. I'm checking his left side renal artery and his right side. No bruits heard on auscultation. Now I'm listening to his aorta. And no bruits heard on auscultation. I'm gonna get you to, I'm gonna palpate all four sides. I'm gonna start real gentle, okay? Tell me if there's any tenderness.
Not at all.
Okay. Now I'm gonna get a little bit deeper, okay? Any tenderness?
No.
Okay. Patient states no tenderness on light or deep palpation. And now I'm going to palpate the liver. I'm gonna I gotta find you right, and I'm gonna have to, it might dig a little bit, okay?
No.
I cannot palpate this patient's liver, which is normal. I'm gonna get you to sit back up for me. I'm gonna inspect both your arms, okay? Look at both. Both of them appear to be symmetrical, no abnormalities, no even hair growth throughout both of them bilaterally. Now I'm going to check your pulses, okay? I'm gonna check your brachial pulse, both sides. Just relax your arms for me. Both pulses are normal bilaterally. Now I'm gonna check your radial pulses. I can feel both pulses bilaterally and ulnar pulses. And ulnar pulses are equal bilaterally. Arms appear to be intact. I'm going to see both your fingers. I'm going to check the cap refill on. Turn them back this way for me. Cap refill bilaterally is less than 2 seconds. I'm going to get you, can you move your chest arm? I'm going to get you to raise your shoulders like this. And then can you do them like this? Alright. And do them again. I'm going to do them against resistance, okay? Can you push down? Push your arms down like this. Yeah. Can you push down? Okay. Push back. Patient can push against resistance. And alright, can you adduct your arms like this? Go from in to out. No hurt. Nothing hurts when you do that. All right. Let's see. Now I'm going to get you. I'm going to test your reflexes. Okay. So first, I'm going to check your tricuspid or your tricep reflexes. Just kind of dangle it for me. Okay. Patient arm does move and does not have hyperactive reflexes. All right, bilaterally. Now I'm going to check your biceps. What I'm gonna get you to do is kind of flex your bicep for me, and kind of let it be loose. Okay. Patient's biceps do not hyperflex. Same over here. Okay. Alright, both his bicep reflexes are normal. Now I'm going to check your brachial reflexes, okay? Just kind of let your hand hang like this. Alright, same over here. Patient's reflexes are normal in his brachials too, bilaterally. Now I'm going to get you to we're going to skip back up to your head. Can you smile for me? Puff your cheeks out. Puff them out. Can you move your eyes? I'm going to get you to follow this, okay? Just keep your head still and follow my eyes, my finger. All right. Patient has a normal response to his cranial nerve 7. Yes, cranial nerve 7. And close your eyes real tightly and frown for me.
You what?
Close your eyes real tightly, and then can you frown for me? Frown. 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 Can you frown? Not smile, frown. There you go. It's hard to do, ain't it?
Mm-hmm.
All right. Now I'm going to get you to I'm going to get you to lay down, okay? I'm going to inspect your legs. Patient's legs do appear symmetrical, no abnormalities seen on inspection. I'm going to check your patellar pulses. Patellar pulses are equal bilaterally. I'm gonna get you to turn that way. I don't think the camera can see your leg. Yeah, I'm gonna get you to turn 180 for me. I don't think the camera can see your. No, put your legs on down that end for me. I don't think the camera can see your feet, your legs. I'm going to inspect his legs now. His legs appear to be symmetrical, no abnormalities seen on inspection. I'm going to check his patellar pulses. Pulses are symmetrical bilaterally, no bounding noted. I'm going to check your dorsal pedis and your Achilles pulses. Patient's pulses are bilateral equally. And patient's dorsal pedis pulses are equally bilateral. I'm going to get you to push against my hands. Alright, and then pull back. Patient's strength in both are equal bilaterally. No abnormalities on his toenails. All of them appear to be flat and rounded, pink. And now I'm going to get you to lift up one leg at a time. Alright, and now your left leg. Then I'm going to get you to cross them side to side. Okay, and now I'm going to get you to rub your heel down your shin on both sides. Alright, patient's cerebellar function is intact. And now I'm going to get you to stand up for me. Alright, I'm gonna get you to close your eyes. And close your eyes, okay? Patient has minimum swaying, so patient passes the Romberg test. Alright, you good? I'm gonna get you to hop on one leg on both sides, just one hop apiece. Alright, and now I'm going to get you to assess your muscle strength by, you already walked on your heels. Alright, I'm gonna let you walk on your toes this way, walk across on your toes, and then turn around and walk on your heels for me. Patient has good balance on both sides and equal and good motor function. I'm gonna get you to lay back down with your legs facing that way. I'm gonna check your reflexes right here, okay? So just kind of relax for me and check his patellar reflex. Well, here, hang it off the side for me. Alright, patient does have normal patellar reflexes bilaterally. Now I'm gonna check your Achilles, okay? Alright, I'm checking this foot. Patient does have normal Achilles reflexes. Now this is gonna kind of feel weird. I'm gonna slide this down both his feet, okay? Patient does have normal Babinski reflex. Now I'm going to get you to sit back up for me. I'm gonna get you to close your eyes for me and stick both of your palms of your hands out, okay? And tell me what number I write into your hands.
Do it again.
Do it again.
Like 8.
We'll try a different number. What about this?
V.
Number. Let me try this way. There you go. That was a 5.
Yeah.
That was a 5. On the left hand. Now we're going to the patient's right hand.
I think that was 5.
That was a 5. All right, good deal. I'm gonna put this in there and tell me if you can tell me what it is. And close your palm and feel it. What does that feel like?
Like a knuckle.
Yeah. And this hand.